Hi, everyone. I'm Holly Porter, Senior Media Relations Specialist at the University of Maryland School of Medicine, and I'm here today with my colleagues at the Maryland Center of Excellence on Problem Gambling at the University of Maryland School of Medicine. Thank you for joining us today to discuss the center's new report detailing rising rates of disordered gambling behavior among Maryland residents. The data we are presenting is the first available since the legalization of online sports betting in the state. You can find our press release on this report on the School of Medicine website, and it should be hitting your inboxes shortly if you haven't already received it. Our panel today will speak to several sides of this issue, from the data collected in high-risk communities to ongoing prevention strategies and legislative developments. And I'll just quickly introduce them. Today's panelists from the center include Dr. Jessica Brown, Research Director at the Maryland Center of Excellence on Problem Gambling, an associate professor of epidemiology and public health at the University of Maryland School of Medicine. Dr. Christopher Welsh, the center's medical director and professor of psychiatry at the University of Maryland School of Medicine. Heather Eshelman, director of operations at the center. Will Hinman, certified peer recovery specialist. And Blair Innes, the center's government relations manager. I'll also note that we are recording today's media panel and everything is on the record. We will have the recording available to you on our YouTube channel shortly after. If you need anything outside of today's discussion, please reach out to me or my colleague, Mike Caffeys, Marketing and Public Relations Manager for the center, and we can work to arrange an interview with you. So with that, we'll go ahead and get started. We'll leave a couple of questions after each presenter, and then we'll open it up to general questions at the end. So to get us started and to present the primary findings of the report, I'll kick it off to Dr. Jessica Brown, Research Director.
Good morning. Thank you very much for the introduction, Holly, and thank you to all of you who have joined today. It's really exciting to see the level of interest in our work. My team and I support the research and evaluation work of the Maryland Center of Excellence on Problem Gambling, and I'll be reviewing some of the results from the 2024 statewide gambling prevalence study. This is a legislatively required study that provides a wealth of information about gambling behavior among Maryland adults. It's now conducted every other year and tracks patterns and trends as more modes of gambling have been legalized in the state. This repeat administration facilitates comparisons in gambling prevalence, as well as disordered gambling behavior as the legal gambling landscape in the state has evolved. The data generated are valuable to the center's mission of promoting healthy and informed choices regarding gambling. And additionally, these data inform policymakers and the public. So the study was broken up into multiple parts. We asked participants about their gambling participation, including individuals who do not gamble. We had an entire module on sports gambling behavior. We asked individuals about their attitudes towards gambling. We also ascertained their awareness of problem gambling resources and help seeking. We also collected sociodemographics on the participants as well. Individuals were considered eligible to participate if they had a residential address in the state and were at least 18 years of age, reflecting the minimum age of legal gambling in the state. A random proportionate sample of residential addresses were identified to develop a representative sample across the state, and households were sent invitations to participate in the study via postal mail. Respondents were given the option of completing the survey via web, mail, or phone, and 2/3 of our completions were over the web. We ultimately received 3,601 complete responses, of which 3,232 respondents indicated they had ever gambled in their lifetime. So this is about 90% of the population. And if we compare that proportion to the prior prevalence studies, we see that this is a relatively stable number over the course of the history of these studies. This yellow bar here is comprised of frequent and infrequent gamblers. In fact, about 42% of Marylanders have gambled 5 or fewer days in their lifetime. So regarding the 10% of the population who has never gambled, When asked why they've chosen not to gamble, the top responses were that they were not interested and they did not want to risk losing money. Now, looking at the types of gambling that Maryland residents have ever tried, we see that lottery and casino are the most frequent. As we see here, fewer than 30% here in this gray line in the middle, fewer than 30% of Marylanders have participated in sports betting in their lifetime. When we look at just past year sports betting, in the 2024 study revealed that 17% of Marylanders have done so, which is up just over 3 percentage points from the 2022 survey. One major difference in the legal availability of gambling in the state between the 2022 and the 2024 studies was the legalization of online sports betting. Thus, the current prevalence study, as was disclosed earlier, is the first study data that are available since that change. Here we have the proportion of Maryland adults who have placed online sports bets within the past year of being surveyed from both the 2022 and 2024 surveys. And it's clear to see that this has grown considerably since the legal availability in late 2022. One of the key indicators of interest from our biennial studies is the prevalence of disordered gambling. That number has gone up in the current study to 5.7%, and this is up from 4% in 2022. Looking at some of the sociodemographic characteristics, men are more likely than women to meet screening criteria. 2/3 of Marylanders who meet disordered gambling criteria are men. The proportion is higher among African American or Black Marylanders at 10.6 compared to white Marylanders at 3.6%. The proportion is higher in Hispanics as well as non-Hispanics, specifically 8.8% versus 5.5%. Additionally, it's also higher among past year sports bettors at about 15%, which we saw earlier had increased participation since 2022. Finally, help seeking nearly doubled among those with disordered gambling. Marylanders across all levels of gambling participation, including non-gamblers, endorsed some awareness of problem gambling resources. In the interest of time, I'm going to stop my comments there, take a couple of questions, and let you hear from the other members of the center.
Any questions on the data or initial findings for Dr. Brown? All right, we'll kick it over to Dr. Christopher Welsh, Medical Director, to talk about his role within the center and provide some additional perspective.
Okay, well, welcome everyone. I'm glad there's interest in this topic. We're always trying to get more, so it's great to see this. So I'm just going to give a little bit of background about gambling disorder and kind of the impacts on someone's mental and physical health, and just kind of, an overview, because I think it's, again, something that we don't talk about a lot, but it's really growing, and I think there will be a bigger interest. So just a little bit of background that for many decades, the American Psychiatric Association, which is who publishes it's called the Diagnostic and Statistical Manual of Mental Disorders, the DSM. That's what we use in the U.S. to diagnose psychiatric problems. So gambling has been in there since 1980, since the DSM-3. But for many years, it was actually not considered addiction. It was lumped in with, it was called impulse control disorder. So it was like, pyromania, people who set fires compulsively or pull their hair out, or it was lumped in with those other kind of disorders. And then in 2013, the DSM-5 came out. And by then we'd had a lot of studies done through the 90s and 2000s, and we were able to much better see what's going on in people's brains using brain imaging technology. And we could see both with other addictions like cocaine, heroin, fentanyl, as well as people while they're gambling, we could see that what's going on in people's brains is very similar when somebody has a gambling problem versus when they have a drug or alcohol problem. So by the DSM-5, when that came out in 2013, the decision was made to put gambling in with other addictions. So that was a really big change in kind of how we look at it, but also, there are a lot of implications just policy-wise and everything across the country. So, for the last 12 years, it's been, at the national level kind of managed and looked at as addiction and not what it was prior. It's a big concern because there's a lot of overlap, much higher rates of other psychiatric disorders in people who have gambling problems, depression, anxiety, much higher rates of other substance use problems like alcohol, pretty much all substances, certainly, tobacco and smoking, but higher rates of opiate use, cocaine use. So we see that. Very concerning is that people with gambling addiction have one of the highest suicide rates of any group you could look at, especially if they have gambling and other substance use problems. Much, much higher rates of thinking about suicide and attempting and actually completing, which you can imagine, somebody who just has lost everything. And you have to remember, most people who are gambling, it's not just them who are affected, their family's affected. If you just lost your child's college fund or your house or whatever, really significant implications for a lot of people. And so, at that moment, a lot of people don't see another way out. So again, it's something that we really have to worry about and screen people for. It also has, effects on physical health. There are higher rates of stress-related things like, even high blood pressure, insomnia, ulcers, other things that, kind of are related to stress that people will see when they're having issues with gambling. So we're really, concerned that we're seeing here in Maryland, the numbers going up. We know that this is even an underestimate. We also know, Jessica said 18 and older. So we're not even looking at teenagers in this, which we know that gambling is going up with them. There's a lot of crossover with gambling and gaming. A lot of gaming now has components of gambling within it, and there's very clear kind of the industry is trying to get young people who are gaming to kind of get into that, and then they'll be progressing to gambling. So just from a kind of mental health and a physical and public health standpoint, really trying to use the data that we have from our survey to try and inform. You're going to hear next from Heather some of the things that we do at our center, but trying to identify people that have problems and get them help. But we really want to try and identify people who look like they may have, they wouldn't meet full criteria for a gambling addiction yet, but if they're having some issues, we're really trying to intervene early and try and help people from progressing to developing, an even larger problem. And then really earlier intervention in schools to try and, help everyone from kind of not even, especially if they have risk factors, for not even kind of starting down that pathway. So again, we're really using these data to try and guide a lot of what we do at the center. The same way, again, that we do with other public health issues here in the U.S., but we're really hoping that this will draw more attention to gambling, which has really not had the attention it deserves. So I'll leave off there if there are questions now, or if not, we can take questions at the end.
Thanks, Dr. Welsh. We'll go ahead and leave questions for the end for now and move along to Heather Eshelman, Director of Operations at the Center of Excellence on Problem Gambling.
Thank you, Holly, and thank you all for joining today. Happy to be the Director of Operations at the center. We do a lot for a staff of 12 full-time people. We're very happy to give back to our communities to help people to retain their wellness when it comes to gambling. So as Dr. Brown said, the mission of the center is to promote healthy and informed choices regarding gambling and problem gambling to all Maryland residents. So if someone is of legal age to gamble, they can certainly do so for fun and entertainment, and most people can do that with no problems. But if a Maryland resident is experiencing problems due to their gambling, we want to help them. That's basically the bottom line. We do a lot of public awareness campaigns. Some of you may have seen some of our social media posts. We also have done in the past like transit signage. We've also done, we have websites, and we've also done other advertising with the Orioles and Ravens. So we're just trying to get messages out there about resources for help that those that may need it. Which leads me to our number one thing that I think we do here at the center, which is maintain the 1-800-GAMBLER helpline. So 24 hours, 7 days a week, people can call, text, or chat that number and can get help for resources that they need to help them to get into recovery, or even if they're just having negative consequences due to their gambling, they don't necessarily have to go to treatment, but they can get resources for help to kind of control that behavior. And basically, we also maintain a provider list here for the state of Maryland. So any behavioral health provider that can provide treatment for disordered gambling, we have them on our list, and they're able to get reimbursed for providing that service through the Problem Gambling Fund. So basically, any Maryland resident can access treatment for no cost. So, and their family members as well. So that's a wonderful thing we have here in Maryland that does not exist in most other states. So financial barriers do not exist for people seeking treatment for a gambling disorder. So, and their family members, which is amazing. We also train the providers. So the mental health and substance use counselors are mostly who we train. Our trainings are free. So we offer CEUs, the continuing education units that the counselors need to maintain their licenses. So they're happy to join usually, and we're happy to have them because we want them to be educated on this topic. So then when they have clients, they're able to, that mention they have a gambling problem, they're able to help them the way they need to. We also do prevention programming, which Dr. Welsh kind of touched on. We do go into schools, and we also do small grants with our colleges here in Maryland. That has really received a lot of interest. Last year, we worked with 16 colleges here in the state, provided them small amounts of money to get basically public awareness out to the students. The students do tables in public areas. They also do their own social media posts, and any way that the college can promote the risk of gambling and also the resources for help on college campuses is what the goal is. And then also we work with some community organizations such as NAMI Maryland and other ones that will promote within the work that they do, integrate problem gambling prevention messaging and strategies within the work that they're currently doing. And we also track public policy, all the gambling legislation, mostly in Annapolis every year. And Blair's going to touch more on that, so I'm not really going to go into that. But we do that. And then also Will Himmons here on this call. We have a robust peer recovery support specialist program, which we're very proud of. We have individuals with lived experience with problem gambling that help others to obtain recovery. So they're there as a beacon of hope for people that need help. So they're an inspiration to us daily, and Will is going to be speaking about that program now because I think I've covered everything that the center does. But if anybody has any questions at this time, I'm happy to take them.
All right, we'll kick it off to Will Hinman, Certified Peer Recovery Specialist at the Center of Excellence on Problem Gambling.
Hey, thanks so much, Holly, and thank you all for joining us. Again, my name is Will Hinman. I'm the peer supervisor here at the Maryland Center of Excellence on Problem Gambling, also a certified peer recovery support specialist. As Heather said, we're all people with lived experience in recovery from a gambling disorder. Just to give you a little bit of my background, I started gambling when I was about 19 or 20 years old at the University of Maryland in College Park. It wasn't prevalent on campus, honestly, back then. I was actually introduced to a bookie at a restaurant I was working at the time. So I didn't gamble with a whole lot of the college students. It was more my peers from the restaurant. But I became hooked at gambling right away. As Dr. Welsh was describing the effect it produced on my brain, it wasn't about the money. I was a very small time bettor. It was just about the action, the effect it produced. The way I describe it, it was my favorite high. At 21 years old, I took my first trip to Atlantic City. I could not wait to go to the casino. When I turned 21, that trip did not end well. I ended up going to the money machine, got in a huge argument with my girlfriend, but I knew I wanted to go back the next chance I got and try to get back my money. But gambling just became my favorite hobby in any form, whether I was, any activity that was competitive, I wanted to have money on the line. And the way I looked at it was, if I didn't have a wager, it just wasn't worth it. Whether I was playing darts, whether I was playing billiards, golf, or whatever it was. Again, I love the effect it produced on my brain. And what happened was in 2012, I found myself gambling at high risk. So, a substantial number of years, over 20 years of gambling for it to progress into that disorder gambling state. But I was gambling at high risk. The company I'd worked at for 24 years had gone out of business. I was going through a major career change. I was struggling with mental health, depression, anxiety. I was struggling with alcoholism. My wife and I ended up separating because of my alcoholism. I found myself struggling with loneliness, grief, and loss. And for the first time in my life, I turned to gambling as a financial solution and as an escape. And that turned into a complete nightmare, to my worst nightmare. It ended with me having a plan in place to take my life. And fortunately, there was an intervention. My family got involved and the police got involved, and I was escorted to a treatment center, which is actually where I was introduced to the Maryland Center of Excellence on Problem Gambling. And an individual by the name of Michael Rosen came to talk to me while I was in treatment, and he got me all the resources that I need to be successful in my recovery. So I'm really grateful today that I'm able to share my lived experience with those that are struggling with the gambling disorder. Since I've become a peer supervisor here at the center, it's been coming up on 2 years. I also oversee the intakes that come in from the helpline, and I disperse them to our other peers. So I'm able to see the types of calls we're getting, and it is a little concerning that we are definitely seeing an increase in calls from young adults, college age, and a lot of times it's their parents, usually males, a few daughters too, but usually males. A lot of times their parents are reaching out first to get help from these young adult males, because a lot of times they don't even want to talk to us. They don't even want to maybe accept they have a problem, or they're just simply not ready to get help. But we have definitely noticed an increase. But other than that, we're just grateful to be able to offer the services that are available in Maryland. Like Heather said, I think we're very fortunate to live in a state that's very rich in resources, that offers a no-cost treatment. As you can imagine, a lot of times, by the time someone's calling the 1-800-GAMBLER helpline number, they don't have any money. They're financially just devastated. So it's incredible that we're able to offer that no-cost treatment to Marylanders. And that includes both residential. I think we have at least 4 residential treatment centers now across the state we can offer treatment. We have a couple IOPs, intensive outpatient programs, and we have, I believe, over 130 outpatient providers for individual counseling. And like Heather said, that's for any Maryland resident that's negatively impacted by gambling. So it can be spouses, it can be parents, it can be, just siblings, whoever has been negatively impacted. So I'm grateful to have those resources. I'm grateful to have my role at the center, and I appreciate everybody joining us today. Thank you so much.
Any questions for Will at the moment? All right, thanks, Will. And we will go on to talk a little bit about legislative updates. So I'll introduce Blair Ennis, the Center's Government Relations Manager.
Thank you, Holly, and thank you everyone for being here. Again, my name is Blair Ennis. I am a public health attorney and government relations manager for the Maryland Center of Excellence on Problem Gambling. I am in charge of the public policy prong that Heather mentioned in the key initiatives of the center. And our public policy work takes us to Annapolis, advocating and educating on problem gambling and responsible gambling. And these prevalence reports are always so helpful in the work that we do there. This report in particular, it being the first prevalence study to come out since legalizing mobile sports betting, I know that Maryland legislators will be interested to see this data, and I am definitely looking forward to sharing it with them. The report highlights that there's room for law and policy change in the state, and so we at the center will absolutely be in Annapolis supporting the bills that we believe are good for public health. And we have seen some bills that we've been excited for over the years. Some of them passed, some of them didn't. And of those that didn't pass, we hope to see them again and be able to support them again in the future. So one bill that I wanted to talk about that actually did pass during this legislative was, and that the center strongly supported, was Senate Bill 310, sponsored by Senator Simonaire, and it increases student awareness of the relationship between gambling and youth suicide by adding it to the Youth Suicide Prevention School Program. We saw this as a bill that would save lives because education and awareness are important parts of prevention. So we were happy to support that and excited to see it pass. Another bill that didn't pass, but that we also strongly supported this year and would like the opportunity to support again in the future, was introduced by Delegate Palakovich-Carr. And it actually had a lot of great provisions in it. So a few that we latched onto at the center was first improving the center's ability to connect with people who sign up for the state's currently existing voluntary exclusion program. Also raising the age to participate in fantasy sports from 18 to 21, which we saw as just a common sense measure, considering you already have to be 21 to participate in sports betting and to go into casinos. And it also prohibited using credit cards for online sports betting. One of the things that we always say at the center is to set a limit and stay within it. And so this was one helpful way to support that limit setting. And then equally as I would say important as supporting the bills that we believe are strong public policy measures, we also oppose bills that are not strong for public policy. And so the big one that we have been going out in force opposing for the past 2 years is legalizing iGaming in Maryland. iGaming is generally defined in these bills as casino-style gambling through the internet, and a simpler way that I like to describe it is casinos on our cell phones. And so we already know that 24/7 online access to gambling is a public health concern. There are a variety of national and even international studies that reiterate that people who gamble online are as much as 8 times more likely to report compulsive gambling problems and addictive behavior than traditional brick and mortar casino players. So our primary talking point, the ease of access to this highly addictive activity can lead to a host of health and emotional difficulties. So we at the center and many of our partners have gone to Annapolis the past 2 years to oppose legalizing iGaming. And if it's proposed next year, we are ready to do more of the same. So thank you.
Awesome, thanks, Blair. So any follow-up questions for Blair, or I will open it up to questions for the entire group at this time as well.
Hi, can I jump in?
Yep, sure.
Hello?
Yep, Danielle, you can
Perfect.
yep.
Just want to make sure.
Please
Um,
state your affiliation as well, please. Thank
Yes,
you.
of course. So I'm Danielle Brown. I'm with Maryland Matters, and I wanted to kind of follow up with kind of what these recovery process looks like. So Initially, I would like to ask Will if you could kind of talk about what the recovery process has looked like for him, and then kind of open it up more broadly to anyone else who wants to speak more generally.
So as they say in recovery, it's one day at a time. I attend a lot of support groups, and actually 2 12-step fellowships, both for alcoholism and for gambling. I still see my therapist on a regular basis. I do a lot of holistic care, acupuncture, meditation, things of that nature. And I offer that lived experience to anyone. Everybody's got to find their formula to recovery that works for them. But there's a lot of resources available within this state, and I offer them anything I can that can be helpful.
Thank you.
Any other questions at the moment?
I mean, just to kind of add on to what Will talked about so that, there, like he said, there's different 12-step groups. Again, we train a lot of providers. In general, like I had mentioned before, there's so much comorbid substance use disorders and psychiatric problems. So you'd like to get somebody in with a provider, because if you don't address all of those issues, it's not likely somebody's going to do well with just the gambling component. So you want to make sure they're getting all those addressed. And then we really haven't talked about some of the kind of systemic things that can be used to help someone with gambling. So there's it's called a voluntary exclusion program that is run through the state, so somebody can sign up and actually they're excluded from say going into casinos. They're similarly with a lot of the sports books, there are ways that you can sign up. Now, granted, people can get around a lot of the things, especially online, but there's some things that somebody can do to try and help make it much harder for them to gamble. And hopefully that for some people, that'll help them kind of, if they have the urge, those things that are in place to make it harder will kind of help them, maybe be able to kind of step back and not follow through with the gambling.
I can add to that too. I'm glad you mentioned that, Dr. Welsh. There's also an app called betblocker.org, which is a nonprofit over in the UK that offers this service internationally. And that's for online gamblers. They can download it onto their electronic device, and it blocks all gambling websites, both legal and illegal. So a lot of times that goes along very well with the voluntary exclusion program, which, by the way, is 5 categories. It's casinos, sports gambling, fantasy sports, lottery games, and bingo halls. They can sign up for all 5 of the categories, whichever categories they want, for 2 years or lifetime.
All right, thank you.
There's also a lot of self-help apps coming out that a lot of the younger sports gamblers are getting into. One is a Vibe that we've been promoting, but there's other ones, Recover Me, and several others. We've had a lot of them reaching out. It's like a self-help technology. They do a daily check-in. They tell you how many days you've gone without gambling, how much money you saved, and offer a lot of other resources on those apps. And we find that very attractive to a lot of the younger people that are gambling.
Thank you both for that. Any other questions at this time? And I also want to leave a little room for our panelists if you guys had any final remarks that you weren't able to get in during your presentation. Do you guys have anything else for the media that we have on the call today? All right, well, we're really glad to have you guys all join us today. As I said before, we have recorded the Zoom presentation and we'll have it posted to our YouTube channel shortly after. If you also need one-on-one interviews, feel free to reach out to Mike or I, and we'll do our best to coordinate interviews with the experts that we have available. And so if there are no further questions, we will wrap up and we will have this Zoom recording out to you guys shortly. Thank you guys so much for joining us today.